For our presentation, we chose to research the Vietnamese culture and how different aspects of the culture will impact their health and overall care. Vietnam is a country located in Southeast Asia near Thailand, Laos, and Cambodia. We chose to examine the Vietnamese culture within America because one of our group members is from a Vietnamese heritage, so we thought that would allow us an intriguing and detailed perspective on this cultural group. According to Pew Research Center, as of 2019, there were 2.18 million Vietnamese within the United States. Of those, 38% were native born and 62% were foreign born. Specifically considering Florida, as of 2015, there were approximately 70,000 Vietnamese within the state. California currently has the greatest proportion of Vietnamese, with highlights being in Los Angeles, with approximately 346,000, San Jose, with approximately 143,000, and San Francisco, with approximately 84,000. Texas contains the second greatest number of Vietnamese, with popular areas being in Houston and Dallas. Another important demographic to consider is English proficiency. 54% of Vietnamese reported speaking only English or English very well. Another interesting demographic was multi-generational households. According to the study, 34% reported living in a multi-generational household, which contains at least 2 adult generations.
Next, we will be discussing the primary values of Vietnamese culture. First, the primary values of this cultural group focus around the role of the elders, respect, and family. Elders are to be respected and are considered highly ranked in the family structure. One should greet elders by bowing slightly, and they should be greeted first. Elders should receive love, care, and respect at all times. If elderly members of the family should need care, it is the responsibility of the younger generation to take care of them rather than placing them in a nursing home. In the family, elders are seen as the leaders and have a great influence on decision-making. In terms of familial organization, a patriarchal system is used, which deems the husband or father as the head of the family, and he also supports the family financially. The family unit as a whole is very important in Vietnamese culture, and oftentimes the immediate and extended family live under one roof and take care of each other. Now, we're going to discuss what makes this cultural group unique. The culture of Vietnamese people is unique in various ways that contribute to their societal structure and relationships. To begin, Vietnamese is the primary language of this cultural group and has regional accents such as Northern, Central, and Southern. Their customs are rooted in Confucianism and Taoism, including the importance of education, family, and elders, as well as the desire to avoid conflict. Vietnamese culture has values influenced around status and prestige. As mentioned, education is of the highest importance, and professions that are highly regarded include doctors, priests, and teachers. In Vietnamese culture, the diet is mainly made up of rice, fish, and vegetables, including chicken or pork. Many Vietnamese, most often the older generation, believe in the yin-yang theory of food, which focuses on the hot, or yang, or cold, yin, food, and creating a healthy balance between these foods. For instance, some hot foods include beef, garlic, or mango, while some cold foods include greens or melons. An excess of hot foods could cause pimples or rashes, while an excess of cold foods could lead to chilliness or diarrhea. Not only is food important in Vietnamese culture to one's health, it is important in celebration as well. One important holiday in Vietnamese culture is the celebration of Tet, which is the Vietnamese New Year. It is celebrated on the first day of the first month on the lunar calendar, usually falling between January 19th and February 20th. Tet is celebrated over 3 days, which each day dedicated to a different group of people. The first day celebrates family and ancestors, the second is in honor of teachers, and the third day is celebrating friendships. The holiday symbolizes new beginnings, and the new year is also celebrated by giving younger generations money in a traditional envelope.
So, how does spirituality, religion, and other health beliefs or practices of Vietnamese people affect health? So, the embracement of the biomedical and naturopathic worldview is very uncommon and it's unique to Vietnamese culture. Most cultures, they'll usually contradict each other, and there's usually conflict between the biomedical and naturopathic worldview because the theories of what causes illness differ very much, but in Vietnamese culture, there's an equal embracement of both. So, doctors are highly respected in Vietnamese culture. Western medicine is, however, considered a luxury. So, those who are upper class usually only have access to Western medicine, and that's why Western medicine is still considered, still highly regarded because it's considered like a rich person's medicine, versus commoners will usually seek out Eastern medicine because it's more accessible and it's used in combination to manage symptoms. It's also used for health promotion. So many people usually use this throughout their daily life because, again, Western medicine is considered a luxury. The hot and cold theory also plays into this. The Western medicines are also considered hot, while Eastern medicines are considered cool. So while there's this embracement of the biomedical worldview, there's also this idea of hot and cold theory that is pretty much merged into Vietnamese ideas of health. And so sometimes when people are receiving treatment and they think that a certain disease is considered hot, they might reject oral medications because they think it might make their illness more hot. And so it's really important to educate your patients and to understand what their ideas are about what causes illness and how to restore it so that we can, understand where they're coming from. There's also this idea of collectivism in Vietnamese culture where a lot of decisions are made in the family. There's also this sequence of familial preference when seeking care for illnesses because there's this sort of stigma associated with this idea of illness, and you want to keep honor inside your family. So you don't want to talk about illnesses outside to other people because it might bring dishonor onto your family. There's also this idea of distrust between outsiders because they feel like outsiders might not understand them or might judge them. In addition, there's also a mental health stigma very much in the Vietnamese community. Depression and mental health is not talked about in the Vietnamese community at all. So a lot of people will usually suffer and have poor mental health outcomes because of this. And this also plays into the idea of religion affecting health, especially with Buddhism and Confucianism. Buddhist beliefs, they are very much integrated into health because this idea of suffering now decreases suffering in the next life might prevent someone from taking pain medications because they might think that it could help them in the long run if they don't. Again, family decisions are very much important in the family. So sometimes patient wishes might conflict with the family, but then they'll just go with the family because they want to keep honor inside the family. Depression is also believed to be a result of sinning in a past life, so that also contributes to a greater stigma surrounding mental health and also contributes to poor mental health outcomes, and that's something that we should be more aware of in the Vietnamese community. So the most common health practices in Vietnamese culture are very much rooted in the naturopathic worldview, where there's this idea of balance to restore health and the use of herbs. The hot and cold theory is also used, as well as this idea of yin and yang, but the adapted version for Vietnamese culture. So the two most common ones that we use are coining, which in Vietnamese is gao ya. It literally means to scratch the wind, and cupping, which is yak. And so the purpose of both techniques are to remove bad wind from the body. There's this idea of maintaining health where you have to have an equal balance of wind in the body. And when there's this imbalance, it causes illness. And so that's why a lot of these health techniques are used to sort of correct this. They're usually used for general malaise, back pain, and neck pain, so that's where you usually see these areas. Those are very common areas for where these techniques will usually be used. And the materials for coining are very much straightforward. You use a coin, which is usually like a size of a quarter, and then the coin is dipped in some minty oil such as menthol or camphor. And then the coin is rubbed along the person's back in a downward motion until the person gets bruised. And the darker red bruising indicates that the individual has too much wind. And you basically do this until the person gets very bruised and you want to make sure that the bad wind is pretty much out of their body. This, in my opinion, is the most popular technique because I have personally seen this. But there's also another one, cupping, and that's used to draw out bad wind. There's a more modern version that we use, and that involves bell-shaped glass cups and this use of a vacuum, while older techniques include the use of bamboo tubes or anything heated, like you can use alcohol, cotton pads, and which are also used for glass cups too, to create this sort of vacuum on your back, and it creates like these pockets. And when you release it, it creates this circular bruising, and it basically helps with the same thing idea of removing wind from your body. So another common health practice in Vietnamese culture that doesn't involve any bruising is steaming, which is also called som. And this belief is that you need to sweat out that whatever is causing the illness to restore the health and, create this idea of balance again. It's usually the idea of sweating out illness or wind, but it doesn't involve any bruising, like I said before. And the materials include hot water, a large pot, a bunch of herbs, usually lemongrass, and then eucalyptus oil and a towel. So basically, the person, they sit next to this hot pot that is mixed with all these herbs, eucalyptus oil, and then they'll cover themselves with a towel over the pot so that they're in this little mini sauna, and they'll stay in there until they sweat like crazy. And basically, the idea is the more you sweat, the more illness you're getting out of your body. Some herbal medicines are also common to Vietnamese culture, include ginseng, ginger root tea, and there's also this postpartum elixir that Vietnamese women usually drink after. It's mixed with a little bit of alcohol and it's mixed with ginger, and the idea is to prevent fainting. So that's something that you should be aware about. Some spiritual health practices include the use of Buddhist monks to pray for serious illnesses, but again, a lot of Vietnamese health practices are very naturopathic. And so usually you'll only revert to religious practices for serious illnesses. But for common illnesses like common cold, they usually use coining, cupping, or steaming.
Health disparities can be defined as the differences in provision and access to healthcare. Health disparities are important because they allow us to identify issues per population so that practical solutions can be made to decrease differences in health as much as possible and to see a healthier future. Within the American Journal of Public Health, a study was done using 7 years of data, and it found that 36.4% of Vietnamese reported a fair or poor health in comparison to whites at 13.9%. In terms of high blood pressure, diabetes, asthma, and heart disease, Vietnamese and whites had comparable scores. However, Vietnamese were more inclined not to have visited a doctor within the last year or to have no usual source of health care. According to a study within the Journal of Immigrant and Minority Health, comparing immigrant Vietnamese and native-born Vietnamese, native-born people had a higher self-rated health score than whites, while immigrant Vietnamese had a lower self-rated health score than whites. The study also noted that Vietnamese were amongst the most disadvantaged of the Asian ethnicity within the United States.
Leading causes of death in Vietnamese people include stroke, ischemic heart disease, and lung cancer. Stroke has an estimated 200,000 new cases every year. 50% of people diagnosed with this condition are likely to succumb from this disease. A stroke is the lack of blood supply in the brain, leading to deprivation of oxygen and nutrients. Symptoms include sudden weakness or numbness to face, arms, legs, and is directed to more than one area in the body. Confusion or slurred speech, eyesight impairment in one or both eyes, complications with walking, lack of balance, and severe headache. Treatments for stroke include early intervention is important in preventing severe complications and can help make treatments more effective. In implementing the following treatments, it can help reduce the risk of stroke occurring. Treatments include lifestyle changes that include more exercises, having an adequate, healthy diet, reducing stress and abstinence from smoking. The second leading cause of death amongst this group is ischemic heart disease. 31% of people in this group die from complications from this disease. There is around 170,000 cases every year. Ischemic heart is caused by atherosclerosis in the arteries. This can cause a narrowing of the arteries and restrict blood flow to the heart. Symptoms include following an episode where there would be a lack of oxygen intake, such as exercising. The symptoms include pain or discomfort in chest, shoulders, arms, back, and jaw. Emotional distress may aggravate this condition to occur. Treatments for this condition include aspirin. It can help reduce the occurrence of blood clot formation because it acts as a blood thinner. Depends on the severity of the disease, and it can help prevent the blockage of the coronary arteries. Lastly, the third leading cause of death is lung disease. Lung cancer is the third leading cause of death amongst this group, and it causes around 20,710 deaths per year. Lung disease is an abnormal growth of tissue and has the capability to cause severe complications. Some symptoms include coughing that gets worse or doesn't go away, chest pain, shortness of breath, wheezing, coughing up blood, and feeling very tired all the time. Treatments for lung cancer include the cancer being surgically removed, chemotherapy to target and kill cancer cells, radiation therapy, and targeted therapy to stop the growth and spread of the cancer. It is important for preventative care to help educate the patient of harmful complications that can arise due to smoking. Smoking has a high prevalence in this cultural group. Approximately 66% of men currently smoke. There is a lack of effective physician-patient communication that makes patient education difficult. There are harmful smoking habits formed within this group. The diseases mentioned can easily be prevented through effective education, therefore decreasing the likelihood that they would succumb to these diseases.
Here, I will be discussing the nursing concerns regarding patients belonging to the Vietnamese culture. So first, I want to address the disease-specific health disparities that exist in this culture, which include hepatitis B associated with liver cancer, cervical cancer, and diabetes. And diabetes is especially common in this group. I would also like to address mental illness in this group because it is often viewed as shameful in this culture. However, because of the high respect that the Vietnamese culture holds for healthcare professionals, this may make it helpful to reduce this shameful feeling and shameful view, the stigma towards mental illness, and it can make patient education very effective for this group. However, it should be noted that because patients of this group hold such high respect for healthcare professionals, they may not voice their concerns due to feeling that they're being disrespectful by disagreeing with the healthcare professional. Now, with regards to healthcare, stoicism, which is defined as when an individual will not address their pain, should definitely be considered because of how common it is within this culture and how difficult it makes to care for these patients. When a patient expresses their pain, it can be difficult to diagnose them because of how important pain is with any symptoms within a diagnosis, and it can be a sign or an indication for certain things. So if a patient does not address their pain, it can be difficult to treat. I also want to discuss specifics regarding women, which should definitely be considered for this cultural group, such as pregnancy among unmarried women be viewed as dishonorable and shameful, and also Vietnamese women are less likely to report domestic abuse. And finally, I want to mention that family is important in decision making because family is seen as an important part. It is deemed extremely important. What in the Vietnamese cultures, they should be included in any kind of decision making and any communication that you're with patients. And so, anytime you are communicating with patients of this group, just remember not to speak in a loud tone because it can be considered rude. Now, there are many things that should be considered regarding Vietnamese patients, but these here on the slide appear to be the top nursing concerns for this group. The final two slides will be discussing how we can address nursing concerns for this cultural group and how we should care for patients. Okay, so to start off our section of caring for Vietnamese patients, I will discuss how patient education and resources can help us care for this cultural group. So this especially applies to the disease-specific health disparities, including hepatitis B, cervical cancer, and diabetes. So it is important to provide resources in the patient's preferred language and to inform them of websites the patient use or any additional information that they would like to have. So I have provided a list of some websites on the slide that can be useful for these conditions. There are some resources that can be found in the Vietnamese language, such as the request website on this slide. It provides a Vietnamese translation as well as an English translation for cervical cancer. And then there are also some websites, such as the CDC, that may provide information in several languages. Or the preferred option is to, when a patient comes to a healthcare facility, it is you can provide your own resources for the condition. When doing any kind of patient education, it is always important to consider providing an interpreter if necessary. And then with regards to the concerns about domestic violence and shame towards pregnant unmarried women within this cultural group, it can be helpful to provide resources and social services. The final topic I will be discussing is relationship and respect. It is always important to establish a trusting relationship with the patient because it may encourage the patient to share more and could reduce what we know as stoicism, which is when a patient will not address their pain. If a healthcare professional were to establish a trusting relationship with the patient, this may encourage them to share their pain because they feel comfortable with the healthcare provider. It is also important to encourage questions within this cultural group because Vietnamese patients may not feel comfortable asking questions because of the high status they believe healthcare professionals hold. So if we encourage questions, they will be more likely to voice their concerns and communicate with the healthcare provider, which could increase the effectiveness of patient education. It is also important to be sure to be respectful to patients and family by being mindful of your tone. So, as I said before, speaking in a loud tone can be considered rude. So, it is important to acknowledge this and consider it. So, be mindful of your tone and also be sure to respect cultural practices such as complementary alternative medicine. And finally, because of the stigma held towards mental illness in the Vietnamese culture, it may be helpful to use the term behavioral health instead. It may encourage patients to disclose more information and make them more comfortable discussing their mental health if you use this term instead of mental health. If you use the term behavioral health, so by relating it to behavior instead of um, their mental state, they may be more likely to share more info about that. So, these are some of the many ways that we, as healthcare professionals, can promote wellness, prevent disease, provide education, and overcome barriers for Vietnamese patients.